Information Station, 1370 WOCA.
Ocala.
All right, hope you're feeling well. That's what I hope. That's my big hope for everybody. 5 minutes after 11 o'clock, and if you're not, or maybe you know somebody who's not, you might want to ask Dr. Riadh Fakhoury a question about how you're doing. This is the Head to Toe Care Show hosted by Dr. Riadh Fakhoury. He is a chiropractic orthopedist, and he's the owner of Fakhoury Medical and Chiropractic Center. Many of us here in Ocala feel better because we've gone there, and he's here to answer the questions about what you can do to feel better and maybe how long it'll take. That's always a big question, isn't it? Good morning, Doctor.
Good morning, Larry.
Yeah, that's always everything. How long is it going to take before I get better, right?
Right. And people are anxious because they've been living in pain for so long that when they come in, they're looking for answers and an immediate response. But sometimes it's taken years to get to that position, so it takes a little bit of work and a little patience and time and cooperation to get them back on their feet again and get them out of pain.
Yeah. You know, we often are told you're treating the symptom and not the cause. And I have a question about that. If I'm in pain and you diagnose it and say, we can fix it, but it's going to take a half of a year. My next question would be, is there any way to treat the symptom while you're working on the cause? So in other words, I could be out of pain maybe next week, but the whole problem will take another 6 months.
Wow, that's a very good question in that the symptom is really not what we want to chase. We want to go to the cause of the problem.
Yeah.
What is the root of it? What is causing the scenario that's producing pain or dysfunction to this patient? And so we may treat the patient, and within a couple few visits, the pain can subside very rapidly, especially as we do our multidisciplinary approach at the Fakhoury Medical and Chiropractic of medical, rehab, chiropractic, massage simultaneously. And so the patient may start feeling better, but at times we have to slow them down and tell them, look, you're feeling better. However, the structure hasn't really healed and strengthened yet. Give it a little bit of time so you don't re-exacerbate or re-aggravate the condition and come back in the same pain or worse pain.
Right.
And it's almost, I tell people, and they relate very well with this, you've had surgery, you had an incision, an incision heals, you feel good, but it takes time to heal on the inside, so you want to be careful not to be too anxious to get too active, which could lead to scar tissue and other problems. So people understand that, and with your body, they're so anxious to get back to their normal lifestyle.
Yeah,
They've been restricted that once we relieve them from the pain, they're anxious to get started, but we have to slow them down. For example, I have a gentleman who hurt his calf at the 18th mile of running, so he's a really an intense athlete. So he's been out of running for 1 week.
Wow.
We've done laser on his calf. We've done ultrasound. We've done massage. He's doing extremely well. He's about 85% better now. So now we have him stretching. On Monday he came in. We had him do some stretches. On Tuesday he did some resistive to start challenging the muscle. And today he's going to start running. And I told him do one-fifth of what you normally do. 20%, and then gradually, if you don't have a problem, then you could raise it up to 1/3, 1/2, and then increase to full activity. So we're going to ramp him up. So that's a good scenario that the symptoms are clearing up, but the structure or the true problem, which was the tear of the calf, takes a little bit more time to heal, and we have to ramp it up into activity. And some people, they'll feel better with treatment, but I tell them that with a little more work, we're strengthening the structure so the pain doesn't come back.
I got you. So it almost sounds like what I was wondering about. I know a guy who, long story short, fell off a roof while working on a 2-story house a couple years ago.
Okay.
They thought he was going to die. Actually, the doctors and everybody thought he wasn't going to survive, but he did. And I saw him the other day. He's fine, but he's got a limp. And I was asking him, how's it going? And he said, well, they say it's going to be another 6 years before I'm back to normal. I said, wow, I wonder how they know that. He said, I wish it would hurry up because I'm in pain. So I immediately thought of you. I mean, he's already been told it's going to be fixed in 6 years. Well, he's the limp, whatever he's doing. But is there a way to kind of mask the pain so that those 6 years aren't so uncomfortable?
There are ways to do that. We have electrical stimulation. In cases that are more severe, we have Dr. Hobbs, who does the interventional medicine, epidurals, facet blocks, trigger points. And we also have the rehab where we can stretch the tight muscles. So some some practitioners may not be aware of all the modalities that are out there to help, so they may think that it will take 6 years, but possibly that person coming in, getting evaluated, and maybe with some functional medicine, we can accelerate that process of healing to get his spine balanced and his musculature's balanced and accelerate the healing process. So we have, for example, we have a young lady. She has a disc herniation. She has an appointment next week with a surgeon, and she came in to see if we can do anything to get her comfortable before she sees a surgeon. We did the full orthopedic neurological examination, and she was clear. She does very well. I wouldn't be surprised if she sees the surgeon next week and he looks at her and says, "You don't need surgery," because she functions well.
Oh, wow, that'd
and
be
there
great.
isn't any pressure on the nerve. So we started immediately at putting her decompression of the spine to open up the spine, massage therapy, rehab to stretch the musculatures, bring range of motion back in, and chiropractic treatment, and checked on her that yesterday evening, and she was doing better. So I wouldn't be surprised that within 3-4 visits before her appointment next week with the surgeon, she will be at a much higher level of function than what she was yesterday.
Let me mention the phone number. If you would like to call Dr. Fakhoury, please do so. You are invited to be part of the show and to ask your questions. The number is the WOCA Climate Control Source Hotline. 352 is the area code, and then 622-9622-622-WOCA. You see, I've always wondered about the differences between the pros and cons of pain versus no pain, and here's why. If I'm limping because I've got pain, I might be causing other problems because of the limp. If the pain is masked, I might use it in a way that I shouldn't and hurt it even more because I think it's back to normal even though it's not.
Larry, that's a very good point that you say, and it happens. So let's talk about that scenario. Let's say you walk, you have a limp, and you have pain. So with that pain, it's frustrating to you, and you will rearrange your body to compensate for that pain that you have. And I know there's a caller in. Let's pick up that question after the caller.
Okay. Good morning. You're on there with Dr. Fakhoury.
Yes, good morning, Dr. Fakhoury.
Good morning.
Is acupuncture ever used for the relief of migraine headache or the prevention of it?
Good question. It maybe not so much the prevention, because migraine headache is more of a vascular problem.
Right.
However, it is very helpful with pain. Acupuncture is very effective at controlling pain, and we refer for that when patients are needing another approach to help in controlling the pain factor. And so yes, we've seen very good incidence of reduction of headaches with use of the acupuncture.
Would it be advisable for a person that kind of knows they're coming down with one because of maybe a cold front's going by, or there's a full moon, or so many other reasons to kick in a migraine, would rush into your office or get into your office as soon as possible, get the treatment? Hopefully that would sidetrack it to some degree and not have so much pain then.
And actually that happens. We have so many patients that will call us as they're driving to the office. As the headache is starting, they can feel it coming on. Sometimes if it's a migraine, they'll get the aura. They hear it or they'll see it before the migraine hits. Or they'll feel the nausea. They'll see the blurred vision. They'll start getting the pressure at the base of the skull going behind the eyeball. They will actually start getting in the car and driving to us, because as soon as we get them, we bring them immediately back, adjust them, break that headache in mid-cycle, and by the time they leave the clinic, almost always feeling better and a reduction of that headache.
Yeah. Do you have people that come in like on an annual basis for treatment, like every once a month or once every 2 weeks or whatever, just to keep it basically under control?
We do. Those patients that are prone for headaches realize that if they come in once a month, once every 2 months, twice a month, depending on what their body needs, they can arrest probably 90% of the headaches. And once in a while they'll have a headache, but they'll come in between time, and we'll be able to deal with it and get it under control then. But they find that if they stay with the chiropractic manipulation, the massage work, and keep the alignment where it needs to be, the pressure is off the nerve, and their incidence of headaches are much reduced. So by default, they find that doing those tune-up or wellness treatments ends up helping them dramatically.
Yeah. So in other words, it's in conjunction with a lot of different things. It's not just acupuncture. it's all different kind of things to treat the same problem.
For sure. Headaches are very complex.
Yeah, I know.
And you know how that is. And also, there are certain foods that trigger headaches. Cheese will trigger, alcohol will trigger, chocolates will trigger. So
Yeah.
certain things will trigger people with their headaches. Lack of sleep sometimes will trigger a headache. Sitting, laying down and reading a book with a thick pillow behind your head might trigger somebody's headache.
Yeah.
Turning your head and to the right or to the left and staying there for quite some time watching a movie, talking to somebody, that could trigger a headache.
Oh, that's
Yeah.
a bad one. I get that too. That one, yeah.
Muscle spasms from the traps up to the base of the skull. When they get tight, they could trigger a headache also. So people get to know what the trigger mechanisms are, and we
Right.
work with them on that. It could be posture also. Think about it this way. If you're sitting up straight right now, slouch forward and you'll see that your head will drop down and will come closer to your shoulders, and that poor posture will put extra stress on the vertebrae of your neck and on the
Yeah.
muscles, and that poor posture can actually trigger a headache. And that's why
Yeah.
with some patients we actually, to help their headaches, it may not be an adjustment, but it could be working in our rehab department, improving their posture and their mechanics.
Yeah. Does your facility offer, should we call it food allergy tests to find out which foods would start a migraine in a person?
You know, we'll do that by history, but if it needs to be more aggressive, we will deal primarily with the musculoskeletal issue. We can
Yeah.
refer out for any type of allergies.
Yeah. Okay, thank you very much.
Thank you for those great questions.
You bet. Bye now.
And,
Bye-bye.
and Robin had a question off of the internet.
Oh, great.
Here it is. If someone has been diagnosed by their general physician with arthritis in the knee, can you help alleviate the pain? And then there's the part two. And can the person get a second opinion from you, which might possibly result in knee surgery? I guess they're trying to figure out a way to avoid surgery.
Right, right. In the case that we have a joint that's wearing out, in this situation it's the knee, the meniscus or the cushion between the two bones is getting thin, the bones are getting closer together, spurring is forming, some cyst formation is forming, so basically the joint is starting to deteriorate. It depends on what stage of deterioration, how much function there is. Larry, you'd be amazed at how many people have arthritis of the knee, living in pain, but when they come in, we look at them from a conservative point of view. We give them some simple exercises to do. We mobilize the knee, we balance the pelvis, we do a massage on the knee, maybe laser therapy, but between the home exercise, between the mobilization, between the balancing of the pelvis, so many cases respond beautifully to a point where it's comfortable enough
Oh, wow.
for them to delay the surgery on the knee. And if you ask most surgeons, they don't have any problem with the delay. They prefer the delay because the longer it is before a knee replacement has to occur, the better it is in most cases. So that works well. Sometimes there's hyaluronic acid, which is injected in the knee, a thick gel / rooster beak. Sometimes
Rooster beak?
Yeah, it's a thick formula that helps to give like a support the meniscus in there.
Uh-huh.
There is also cortisone injections, of course, if necessary in that. But sometimes we find that patients are having knee problems because the inside muscle or the inside strap of the knee is weak and not working, and the outer muscles are over tight and causing the knee to bow in and putting a lot of pressure on the joint.
Oh, wow. So actually, small answer coming from me, there's hope for this person.
Oh, for sure, there is. And so we have quite a number of people that come to the Fakhoury Medical and Chiropractic Center for a second opinion
Yeah.
prior to surgical procedure. And when necessary, we'll tell them if there's another option,
Yeah.
we'll attempt that. And with a few visits, we'll know if it's helping or not. So if this person is uncertain about moving forward with the surgery, wants a second opinion, they're more than welcome to come in and let us evaluate that and see if there's other options to help defer, delay, or avoid the surgery.
I would always opt out of surgery if I could.
And what's interesting is most surgeons will find ways to help you to opt out
They
of it
want
if
you to, huh?
possible. Yes.
I wonder why. I mean, is the actual process of cutting into somebody permanently changing them in any way?
Well, if you have a good surgeon and they have a patient in front of them and they know that there is a way that this patient can have a substantial relief without having to have a part removed or a bone invaded or
Right.
or muscle torn or swelling or potential scar tissue or the possibility of damage or something greater, they would prefer that. They will try all other options before going in and doing surgery, and that's why at the Fakhoury Medical and Chiropractic Center we'll actually get referrals from orthopods and from surgeons for the patient to come get evaluated and treated at our office, in the hopes that we can avoid further surgery or the surgical procedure.
Is there any statistics that you know? I'm probably throwing you a curveball by asking you that. Another, just maybe that you do know, or that you could just guess at. Do you have half the people coming in that ended up not needing surgery? Is there a...
It's hard to put a number on that, but I just know that a significant amount of
Right.
people function and manage well, and their pain factor is low enough that they can manage with it and avoid the surgical procedure at that time.
And is the knee an area that often is very successful with other procedures, alternative procedures?
Yes, and a knee is a very easy joint to take care of. It's a very simple joint and responds very well to conservative management. Now, if it's bone on bone, there isn't much motion, which we call ankylosing, and there's lack of motion in there, and it's extremely painful. And we know that there's not much that we can do conservatively to help that person. Then the replacement of the knee is a great form of treatment to help that person get back to their normal living again and reduce their pain factor.
I found it interesting, I think it was last week, when one of your callers mentioned that the plantar fasciitis he was experiencing
Yes.
actually started getting better when he tore something in his foot.
Right.
I thought that, in other words, he had to go through more pain in order to finally get better.
Right. We mentioned that there might have been an adhesion in there, and
Yeah.
that might have been a tearing of the adhesion and opening that musculature and that fascia up, so that way it was not constricted the way that it was.
I'm guessing people who have that kind of a pain probably go more than the 3 days you recommend. It's probably years before they finally have something done about it.
And not only just plantar fasciitis, but a lot of different types of pains. People put up with pain, and they go with it until it interferes with their life. But by that time, it's a layering process. You have your core problem, and then your body compensates, and then there's another problem secondary to that shows up, and then another secondary to that problem, and another one. So you start getting layers of problems, and when they add up to a point where you can't function, or you get scared because, let's say, you drop something, your arm is numb, your headaches are so severe you start losing days from work, that's when we start seeing patients come in. My recommendation is come closer to the core, to the problem. If you're out swinging a golf club and your back hurts you, if you work in the yard, your back hurts you, if you're in an accident, trauma, and your neck is tight, that's a good time to look at it, as opposed to 6, 8, 10, 12 months later when it's more complicated and more chronic. The longer it's been there, the harder it is and the longer it takes to undo it.
We had an author this morning who was talking about stroke and the different things that can aggravate the body and cause a stroke to happen. And one of them was diabetes. I was surprised that that would have an effect on diabetes. I mean on a stroke. That diabetes would have an effect on a stroke.
Well, remember, with diabetes, you usually have hyperlipidemia or extra fat in the blood. Cholesterol, triglycerides are higher, more chance of plaquing, more chance of cardiovascular disease, and all you need is just a little bit of that to break free and find a small blood vessel and block it, and then that's where you'll start having some problems.
Is there anything in a chiropractic that would help with diabetes or help with the conditions that might lead to high blood pressure or possibly a stroke?
Well, at the Fakhoury Medical and Chiropractic Care Center, our care is based around trying to improve that person's well-being and their health. We can't undo the diabetes. That is a problem with the pancreas, that's a problem with insulin, and there's two types. Either they were born with it or at a very young age, or else later in life they started experiencing it with the type 2 diabetes. However, what we do is we improve the general well-being of the individual. It could be through exercise, through flexibility, getting them more active, and helping them maybe to shed some of the pounds. Type 2 diabetes responds very well to weight loss. When the weight starts coming off, then the shape of the cells starts to change, the receptors work better, the insulin's more effective, and then some people have been able to get off of medications, dropping their weight. So it's a hand-in-hand treatment with their primary care physician who's looking after them with the diabetes, as well as us making sure that if they're in pain and not as active as they'd like to be, helping them to feel better so they can be more active, and in that sense helping them to shed some of those pounds so that way they can be healthier.
Just shifting the subject a little bit, the whole subject of showing up at a doctor's office within 14 days, the new law after a car accident. Do we have limitations on who we can see? Can we see you?
Yes.
Yeah. Okay.
Yes. There's no restrictions. Actually, the Fakhoury Medical and Chiropractic Center is equipped to help people that have had traumatic injuries. Why? Because within our office and within the center, we have different types of modalities to help that person regain their health. We also have the right professionals in there. We have a medical doctor who has experience in the emergency room, urgent care, occupational medicine. For 25 years, he's just dealt with musculoskeletal problems, with injuries, with traumas. Dr. Shanawani doesn't do family care. He doesn't do primary care. He focuses on helping us at the Fakhoury Medical and Chiropractic Center in evaluating that person from a medical component to see if there's anything that we as chiropractors may not be looking at, so we get a more encompassing care for that patient. So sometimes we're finding patients are not going to the emergency room or ED, but coming because of Dr. Shanawani's experience from the emergency room, evaluating them, ordinary CAT scans if necessary, ordering x-rays.
Right.
If it's a problem that needs to go to the ED, at that point we can refer them there directly. If they need an MRI, we can order that. And then once they're cleared, and he's found some interesting things, subtle injuries that people have from a car accident that they don't realize that will really have an effect. For example, he found a patient that had a double bilateral tear of the retina, and so that retinal tear is very important. That needs to be addressed immediately so that way, blindness doesn't set in. So he was able to find that, take care of that. Another one, the sac of the eyeballs filled with a fluid, very thick fluid. There was a leak in that, and he was able to address that and take care of that. He's found one patient that actually had a lacerated kidney that needed to be airlifted to Shands and taken care of. So he's looking at that patient from a medical point of view.
Right.
We're looking at him from chiropractic. But when that patient comes in, they're getting encompassing care. And, of course, we have full rehab facilities, the deep myofascial medical massage therapy, the chiropractic with Dr. Teeter and Dr. Hutchison and Dr. Hansen and Dr. Kim. So we're available, and what happens sometimes is very interesting. Sometimes patients will get hurt, and they will come directly to us. And our facility is available to take them in on an emergency basis immediately, or we'll get phone calls during the day that so-and-so was in an accident, and, of course, come in immediately. Number one, we want to get the care started immediately, because if it's something that needs to be addressed, let's get it taken care of. If it's something that we need to get taken care of, we can start immediately with that. Also, secondarily, we want to be within that 14-day window with the new law, or else all benefits are void at that point. So we want to get the care immediately, and it may not be something that we can take care of, like that gentleman with the detached retina. We had to refer him out immediately to get the surgery, but whatever it takes, evaluate the patient and get the best care for them.
And speaking of new laws, as of January 1st, everybody in this country, in the state of Florida, is required to have health insurance. And without making this a political conversation, the good thing I see, I hope I'm right, or at least they're right, is that the person right now who only goes to the doctor when it gets so bad he can't stand it and ends up in the emergency room might say, you know what, I've got insurance for the first time in my life. Let me go see Dr. Fakhoury and see if he can help me with this thing, because it's not emergency room level, but at the same time he's dealing with something he'd rather not deal with. I wonder if you're going to start to see that kind of a change.
We're seeing that mentality over the past few years. People are more proactive in taking care of themselves. They come in with, we see people of all walks of life coming in and getting themselves taken care of, because the emergency room is geared towards life and death, and that's really what their focus is. And so people are realizing that the emergency room is a great facility to have great caregivers, great providers. We are blessed with wonderful, urgent care and emergency room settings here.
Right.
But they're really there for life and death or very urgent situations. That's a small population. The majority would need somebody to look at their problems more in an off-site setting like the Fakhoury Medical and Chiropractic Center. And we're seeing people walking in saying, my neck is bothering me, my arm is feeling a little numb. I'd like it checked out. I want to know what's causing it and if you guys can do something for it. And that's where we'll do a thorough history examination, evaluation, take x-rays if necessary. And if we can take care of them, start the process of getting them in shape.
What is normal when it comes to the foot falling asleep when you are asleep, or the arm falling asleep when you are asleep? Is that normal, or should that not be happening?
Well, here's normal. Normal is that the listeners, you and I, are sitting here, and we don't feel any part of our body.
Okay.
That's normal. That's what we should do. We shouldn't feel our fingertips. We shouldn't feel our arm. We shouldn't feel a stabbing pain in our shoulder blade. We shouldn't feel tightness in our low back. Our legs shouldn't go numb when we walk or sit for a period of time. That is a normal setting. When you start to feel pain in your ear, pain in your jaw, numbness into the arm, numbness and tingling of the leg, spasms in the low back, your body is telling you something is just not normal, and that's where it needs to be addressed. And that's where most people will come in and get that taken care of. You talked about that person with the limp that doesn't feel pain. That's the one I worry about, the one that does not perceive the warning their body is sending them, because their threshold of awareness of pain is much higher than somebody else.
Yeah, maybe.
And because of that, what happens is that they may let that problem proceed to a point where they may never feel pain, but all of a sudden they might start dropping things. And so the weakness brings them in. But then by that time, if we see weakness, it's been there a long time.
Another good reason to stress the 3-day rule. If it hurts 3 days, you better go see somebody.
That's exactly right. If it's continuing 3 days plus, then something is not right. We need to find out what the cause of it is, and it's always, we don't want to really chase the symptom. We want to find the cause and go right after that cause and improve that and get that to heal and recover, and that's where we'll have long-lasting health.
Stay healthy. Call Dr. Fakhoury. He'll help you out. What is your phone number?
The office number is 351-3413. And that will take you directly to the front desk or our patient care coordinator. Answer any questions that you have. So it might be an insurance question, might be a scheduling question.
And where are you? Where's your office?
We are on 17th Street. As you're heading over 441 towards 200, you'll go over the bridge, bottom of the bridge. You'll see the tan building on the right-hand side. At the light, make a right, and it comes right to our office, and they're Monday through Saturday.
Beautiful people inside a beautiful building.
Thank you very much.
Thank you, Doctor. Always good to have you in here.
It's a pleasure.
We'll take a little break and be right back.
Hello, this is Dr. Riadh Fakhoury, chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Listen in to the Head to Toe Care Show every Wednesday, 11 a.m., right here on WOCA. Learn how your body works so that you can help yourself. We're available to answer your questions every Wednesday at 11 a.m. on WOCA, The Source. That's Dr. Riadh Fakhoury on the Head to Toe Care Show every Wednesday, 11 a.m., right here on WOCA, The Source.
Ocala's information station, 1370 WOCA.
Ocala.
The weather is brought to you by myfwc.com. Life jackets save lives. Wear it, Florida. Mostly sunny today. The afternoon highs ranging from 80 on the coast to 87 inland. And tonight it'll be mainly clear and comfortable. Low 60 to 64. Partly sunny tomorrow. High 81 on the coast, 87 inland. For Friday, sunshine and some clouds. High 83 on the coast, 89 inland. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala home store on Northwest 27th.